Hi, everybody. We're going to get started very shortly. I can see the participant list is starting to populate. I'm going to give everybody about 30 seconds or so to get into the room, get on this webinar, and then we'll go ahead and get started. All right. Right now we have about 60 plus participants on, oh, it's going up. They're up to 67. So let's go ahead and get started. My name is Richard Price. I want to thank everyone for joining us today. Good afternoon to everybody on the East Coast. Good morning to everybody on the West Coast. Thank you for joining us. The Council on Public Transportation and the Multi-State Transit Technical Assistance Program welcome you to the end of summer 2020 virtual meeting. My name is Richard Price, and it gives me great pleasure to introduce the Chair of the Council on Public Transportation, Secretary of Washington State DOT, Roger Millar. Roger, please take it away.
Thank you, sir, and good morning or afternoon to all of you, and thank you for participating in today's session of the end of summer virtual meeting. We had a great session yesterday talking about state DOT compliance and oversight activities during the pandemic. Fascinating subject. Today we're going to have another great session. It's going to focus on transit's role in pandemic response and preparing for the next crisis. And that's an important topic. As I mentioned yesterday, our thoughts are with our colleagues in Louisiana and Texas as they serve the public in the next crisis for their communities. So we are responding to the pandemic today and getting ready for the next one, which could happen sooner than you expect. But before we get into the topic, we have a very special guest joining us today. I'm really pleased to let you know that our special guest and keynote for today is Federal Transit Administration's Deputy Administrator, Kay Jane Williams. Ms. Williams has more than 20 years of executive management experience. Since joining FTA in August 2017 as the Deputy Administrator, she has served as the Acting Administrator and focused on implementing Transportation Secretary Elaine Chao's three top priorities: safety, infrastructure investment, and innovation across all of FTA's programs and initiatives. Ms. Williams leads an agency of more than 500 people located in Washington, D.C. and 10 regional offices across the country, with an annual budget of approximately $15 billion in formula and competitive grants investing in America's transit infrastructure and new and innovative technology. In 2020, she is overseeing FTA's distribution of $25 billion in funding under the Coronavirus Aid, Relief, and Economic Security, or CARES Act. She also recently launched the Accelerating Innovative Mobility, or AIM initiative, to advance innovation within the transit industry by focusing on new public transportation service models, integrated fare payment systems, and automation to improve mobility for all Americans. I'm really looking forward to the administrator's talk. Please take it away.
Great. Thank you, Roger, for that kind introduction. I had the opportunity to meet Roger last January at an event announcing a capital investment grant for Spokane Transit Authority's Bus Rapid Transit line. And that $53.4 million BRT project is a great example of a successful local, state, and federal partnership. We appreciate Washington DOT's support of that project and of transit. And I appreciate the opportunity to meet with you again, Roger, even if it is virtually. I'd also like to express our concern and how our hearts go out to the people of Louisiana and Texas as well. I've been in touch with many of the operators there, both yesterday and today, and certainly have them in our prayers and continue to reach out to them to provide federal support. I'd also like to take a minute to acknowledge AASHTO's leadership, particularly Executive Director Jim Timon, as well as Shane Gill and Richard Price. I've been meeting with Jim and the leadership of APTA and CTAA every 2 weeks throughout the COVID-19 public health emergency. And I have to tell you, our discussions have been invaluable in helping us understand the needs of transit systems and state DOTs as we work together to recover from COVID-19 and help local economies recover. On behalf of Transportation Secretary Elaine Chao, thank you for inviting me to speak to you today. I'm happy to join you to highlight FTA's ongoing partnership with the State Departments of Transportation and our rural transit systems. AASHTO is vital in its work to support transportation in communities across America, helping people get to jobs, school, healthcare, and other critical community services. First, let me begin by saying thank you. From the beginning of the public health emergency, the transportation industry has provided essential services to communities large and small across our entire nation. You have supported transit agencies that transported essential workers in healthcare, emergency response, and food services, jobs that have sustained all of us over these past few months. And during this time of incredible challenge, our transit partners have demonstrated resilience and dedication to provide critical transportation services for every American who depends on public transportation every day. Thank you on behalf of Secretary Chao for all you do in each of your communities across the nation, especially as our local economies continue to reopen. We appreciate all you have done to keep America and Americans moving. For example, the Heart of Iowa Regional Transit Agency, HRTA, which operates in 7 central Iowa counties, has continued to take people to work, healthcare appointments, and grocery shopping throughout this public health emergency. Beyond its regular routes, HRTA added food and meal deliveries to people sheltering in place. HRTA also took steps to protect their most important resource, their frontline workers. Drivers were provided personal protective equipment, including protective facial coverings that were distributed as part of the President's whole of government approach to combat COVID-19. As part of this federal distribution, more than 2,200 transit agencies received more than 14 million facial coverings for both their workers and their riders. HRTA operators now work behind new transportation or transparent protected shields, and some have even received monetary bonuses for their dedication to their communities during this public health emergency. But perhaps most meaningful for those frontline workers are the messages HRTA leaders send every day via tablet. Reminders about safety and social distancing, but also messages of appreciation to thank them for their selflessness and their dedication. So I'd like to take this time to say thank you to Iowa DOT Director Scott Marler for your leadership. As you know, under the CARES Act, FTA received $25 billion to support the transit industry, and to date, we have awarded more than 90% of those in grants, totaling $22 billion to states and communities across the nation, helping keeping America's economy moving. This emergency funding is in addition to the Trump administration's investment in infrastructure improvements as we focus on balancing federal support between the nation's urban and rural areas to ensure equity in transit funding. Last year, the Secretary launched the TIFIA Rural Projects Initiative program as part of the Rural Opportunities to Use Transportation for Economic Success, or ROOTS, initiative to ensure rural transportation infrastructure's unique challenges are considered as we keep our rural communities economically competitive. The Rural Project Initiative makes TIFIA financing more accessible to smaller communities and offers some significant benefits and savings to rural sponsors. In fact, 3 transit agencies have already filed letters of intent to notify the department of their interest in accessing this funding, and one of those projects is already in process. In addition to investing in infrastructure, innovation is also one of Secretary Chao's major priorities. And innovation, as you all know, couldn't be more important as we face today's unprecedented challenges. And meeting those challenges and our riders' expectations across all of the modes of transportation couldn't be more important. So today, FTA announced $14 million in funding for 25 projects under our new Accelerating Innovative Mobility Program known as AIM. These grants help transit agencies across America advance new technologies that provide more efficient and frequent service, enhance the rider experience, and lead to better mobility. The selected projects will explore the latest transportation technologies and services, including microtransit, multimodal mobility, automation, and the very important contactless integrated payment systems. Our investments through AIM will play a vital role in fostering innovation and promoting safety as the nation continues its economic recovery. For example, the Minnesota Department of Transportation will receive a $628,000 AIM grant to create a digital platform that will allow riders to plan, book, and pay for and track trips across multiple transportation providers in 13 counties in southern Minnesota. And as it integrates scheduling and fare payment information across rural and urban communities, the digital platform will equalize opportunity for transportation, particularly for rural residents. Congratulations also to our partners at the Oregon and Iowa DOTs, who will also receive AIM awards. As you are well aware, buses are the workhorse of public transportation, and our bus systems have proven to be all the more important in providing critical services throughout America during these difficult times. FTA continues to support state DOT projects in rural and small urban areas as part of our competitive grant selections. In fact, earlier this month, we announced the Trump administration's investment of nearly $500 million in buses and bus facilities throughout the nation to repair, restore, and rebuild our critical transit infrastructure to improve access and mobility for riders across all of America. Much of the federal funding support from this program will reach rural areas and small urban centers too. For example, in Colorado, 5 rural transit agencies will receive a share of $14.9 million through CDOT to improve the safety and reliability of their bus systems and enhance mobility for transit riders. These include grants to the Roaring Fork Transportation Authority, the town of Estes Park, and Archuleta County to build and renovate bus maintenance facilities. And Eco Transit and Durango Transit will purchase buses to replace aging buses that have exceeded their useful life. These CDOT projects will help make a real difference in keeping well-maintained buses on the road throughout mountainous terrain and challenging weather conditions, and ultimately provide riders access to critical services and jobs in larger population centers. Rural areas have also received a significant share of funding in other competitive programs as well. For example, in June, rural and small urban areas were awarded $63 million in FY 2020 low or no emissions competitive funding, which was 49% of the funding awarded in the program. In addition, $2 million or 56% was also awarded through our Mobility for All program to rural and small urban areas. And as you all well know, this is one of our new programs that supports improved mobility for older adults, individuals with disabilities, and people of low income. And in January, FTA announced FY19 project selections under the Tribal Transit Competitive Program, totaling $5 million to American Indian tribal governments and Alaska Native villages, which supported 39 projects in 20 states. Thanks again so much for inviting me to join you today to highlight FTA's important partnership with AASHTO as we work together to support public transportation in communities across all of America. And now I'm happy to take some of your questions.
Thank you, Jane, for those remarks, and thank you for the partnership. I know here in Washington State, under Linda Gerke's leadership as the regional administrator, we've had investment all over the state in public transportation that's truly making a difference for people who need the service. So let's get into the Q&A session. We solicited questions from members in advance of today's session and got a bunch of great ones. So let's get started. We'll start with a question from New Mexico DOT's Dave Harris. Dave asked, is FTA planning any greater flexibility with current and past formula grants for rural areas 5311 and urbanized area formula grants 5307 appropriations beyond the current emergency relief rule? If not, is there any contingency being prepared to delay any potential for lapsing funds?
Okay, so first what I would say is that, we tried to exercise considerable flexibility, and most of that flexibility is under our emergency relief program for both rural and urbanized area formulas. And we allowed that funding to be used at a federal share of 100%. And that is for capital and operating during the public health emergency. So we believe that we have been very flexible to date on those funding opportunities for grantees to decide, when you see one transit agency, you've seen one transit agencies. So we wanted to be as flexible as we could be. If you have suggestions of where we could be, there's additional ways that we could provide some flexibility, please get in touch with either our regional office in your area or go to our emergency relief docket online. I know that by law, there are some funds that are scheduled to lapse that we have no control over by October 1, the beginning of the new federal fiscal year. So if you have funds that you are looking at lapsing on September 30th, please get in touch with your regional administrator for FTA to identify those and see how we can get those obligated and allocated out to you as soon as possible so that they do not lapse. We don't want anyone to have lapsing funds.
Thank you. The next question comes from Caitlin McClanahan from Tennessee DOT. The next crisis for many transit agencies will take place when the CARES Act funding runs out, as the pandemic has hit DOT and local funding sources hard. Does FTA have a plan of action for addressing federal funding lapsing dates or match levels to accommodate ongoing local match shortfalls?
We recognize that there's a lot of people hurting out there in the industry. And we also know that there's a lot of discussions going on in Congress right now, even though they are both out of session, those conversations are still going on with how to address this next funding for COVID-19 relief. And as we see what happens with that, we will work expeditiously to get any new additional funding out to the industry, especially those that are around local match requirements. That's something that we will, continue to work very quickly with all of the industry on. So we will have to wait and see. Congress has the purse strings, and so we'll have to wait and see how that all comes together. But we're hopeful that you will get more funding and we'll be able to get it out to you expeditiously.
Great. We have a question from Florida DOT's Liz Stutz. It asks, will the match be waived for the 5311 program for the apportionments over the next 5 years?
As I mentioned earlier, we don't have the authority to waive local match in 5311. We only have flexibility within our ER program, our emergency relief program. But what I can tell you, if Congress gives us additional authority, we'll work expeditiously to exercise it.
Great, thank you. We have another question from Dave at the New Mexico DOT asking, will FTA be granting oversight waivers to state DOTs for FY 2020? In other words, bypassing the technical site visits. If not, we may need to update state management plans to avoid SMR findings.
Right, yes. In March of this year, we took action to pause those site visits, both oversight reviews as well as triennial and state management reviews, because we felt it was really important to focus on protecting the health and safety of everyone involved in the oversight review process, and also to make sure that you all had the opportunity to focus on assisting your communities in battling COVID-19. So we paused those in March of 2020. We're now preparing to conduct those postponed reviews virtually. So no FTA staff or contractors will be coming on site. We believe that is probably the best way to keep everyone safe. And they won't start those reviews until probably the first quarter of 2021, meaning January to March of next year. And so we're finalizing those details. And as we get those details more finalized, we will get that out to you. But we don't expect you all to conduct technical site visits of subrecipients for oversight. So I wanted to make that clear, or any in-person, site reviews during the public health emergency. We understand that that puts you in harm's way. And so we wouldn't expect for you to be doing those.
Great, thank you. Texas DOT's Mark Sprick asks, how will FTA facilitate information sharing and lessons learned specific to transit from this pandemic?
So, that's one of the things that I've focused on since I came to FTA is how we share information with the industry and make sure that lessons learned in one part of the country are shared with other parts of the country. And so that was something we were keenly focused on as this was all unfolding. And so we have done, we've hosted monthly COVID-19 recovery listening sessions where we bring together transit stakeholders from all over the country where they can hear what's working and quite frankly what wasn't working so that they can learn from one another how they're handling the pandemic in their area. We began that in May and we've held 3 so far. We've had about 800 stakeholders so far that have attended those, and we're going to continue those through the end of this year. We also just launched the COVID-19 Recovery Discussion Forum, and that's going to be a platform that's easy to use for transit stakeholders to engage in peer-to-peer level exchange. So they can post questions, you can post comments and ideas, or solicit specific peer information and resources. And so we believe that's a great tool to use as well. And then lastly, we're preparing to publish a COVID-19 recovery practices in transit resource. And that's going to provide the best worldwide best practices in sanitation and cleaning and disinfecting vehicles and communication with riders and what technology and innovation is happening in the industry across the whole world. And so we are looking forward to launching that in the coming weeks to help everyone understand what is happening on a worldwide view and what, quite frankly, is working that may work here as well.
Great. Charles Carr from the Mississippi DOT asks, can the current school bus restrictions be flexed to allow local excess transit bus capacity to be used to help local schools with social distancing as schools reopen?
So service to schools is eligible for FTA financial assistance, but to serve a school and transport school children, the service has to be open to the general public. So an FTA grantee can operate exclusive school bus service in only 2 situations. One is it has to be completely separate from the public transportation service, and meaning that no federal funding, no FTA funding has gone towards the service. Or 2, when a private school bus operator cannot provide adequate transportation, which is sort of, I think, getting at his question with the social distancing required now. If you want to operate that kind of service, you can request our approval or an exemption through our FTA regional office, and we're happy to look at that for you.
Great. And last but not least, we have a question from Michigan DOT's Andy Brush. And Andy asks, given the success and high demand of delivering groceries and prescriptions to households during the pandemic, has FTA considered allowing this long term? It addresses some mobility gaps and equity issues in both rural and urban areas and has improved and maintained the health and well-being of many people who can't afford more expensive options for food and medicine delivery.
Yeah, so home deliveries are allowed as incidental use if they don't adversely impact transit service, and non-transit expenses are funded by a different entity. So FTA authorized, though, the use of the funds to cover operating expenses associated with these types of services through January 20th of next year. So what we can do is we can look at whether or not that needs to be extended further, but right now you can use FTA funds. Those are authorized to use for those purposes through January 20th of 2021.
Okay, and hopefully into the future, but we'll see.
Yes.
So Jane, thank you so much for joining us today. Our members truly benefit from your leadership of FTA, and we appreciate what you and your staff do with your ongoing assistance in funding transit programs in the small urban and rural communities that we serve. So thank you so much.
Thank you, Roger, and thank you again for inviting me to participate, and thanks for all you all are doing in your communities during these unprecedented times. You know, I'm confident that we'll get through this as we continue to work together and build on each other's experiences, and because we're stronger when we're together. And just want you to know to please stay safe and healthy, and keep doing what you're doing. We appreciate all of your work. Thank you.
Great, thank you. Okay, now, after, it's always great to hear from Jane and hear what her and her team are doing. But let's get started with our session. I'm going to turn the session over to our moderator, my colleague at the Washington State DOT and the chair of MTAP, Don Chardock. So Don, please take it away.
Unmute, right? Thank you very much. And I second the thank you to Jane. I just want to mention, you can definitely tell the difference between the East Coast folks and the West Coast folks by the amount of ties and collared shirts. And so I'm really happy to see that, and we're glad to see that we're keeping up the tradition. One of the things I love about MTAP and the council is the peer-to-peer support that we offer each other. It's never been as important as now, when we're dealing with something new. In this case, we're figuring out the state's role in a pandemic. In Washington, we've been working on this in several fronts. First, safety. We're working with Roger's boss, Governor Inslee, on what that means. And so the transits, and I'm sure this is true all over the country, have already done a terrific job of improving cleaning, figuring out how to space passengers out, putting up physical barriers, wearing PPEs. And we're basically working on how is transit considered? Is it considered a business? If so, what does that mean for the different rules? And then also kind of following up on our presentation from FTA, special thanks to them. We've also been using the FTA's COVID-19 safety advisory, asking all of our partners and starting with the light rail agencies, because we're the official oversight body for them, how they are following that advisory. We're not being terribly heavy-handed. Essentially what we're doing is reviewing for reasonableness, asking questions, and making sure that everything makes sense. And we're about to do the same thing now with all the bus transit agencies throughout the state. Was just on the call with the governor's office right before this one. And so we're working through these things. And then we're considering our next steps. To steal a line from Roger, it's you never want to let a good crisis go to waste. I'm sure many of the state DOT transit offices from across the country have for years been thinking, if we could just change this measurement, if we could just change this one different thing, we could greatly influence how transit participates in the overall transportation system. While balancing the fact that many of our external partners are in a triage mode right now, we are also realizing that the chaos also opens doors. People are now willing to look at things differently and consider things differently. And so we're currently working with our partners and engaging our partners on a rethinking transit and mobility in the new normal. And so we've set up several different planning groups to engage in pretty quickly for our planning purposes over the next several months, so that we're able to offer input to both the governor's office and to the state legislature as they get ready for the new session. So today we're going to hear first from two others, states, to find out how they're doing some of these same things. Liz Strutz and Bobby Westbrook from the Florida Department of Transportation will share what they're doing, and Charles Carr from Mississippi will do the same. And then after that, we're going to open it up. We're going to do some polling. We're going to do some online discussions. So be ready to chime in. And so we'll be calling on some of you to participate. And Richard, unless there's anything else, I'll hand off to Liz.
Just before we get started, I didn't state this right up front, but I want everybody to understand. We are currently recording this. So if you missed anything that Jane said, or you missed anything that any of the other presenters say, or any of the poll questions and the results, you can come back and watch it, as well as all of the information will be posted to the MTAP and the council's website at the conclusion of this end of summer 2020 virtual meeting. but please, let's go ahead.
All right. Well, thank you, Richard, and thank you, Don, for setting the stage for us. In Florida, in any given year, our emergency management roles deal with hurricanes, with fires. We've dealt with floods. We even had a small earthquake, so we couldn't let California be the only ones who had to deal with those types of things. But I am very, very lucky that I have such a great team that deals with all of these emergencies on a regular basis. The pandemic, however, was something entirely different. And so we had to shake off the cobwebs of doing things normally and look at approaches that served our transit partners in the best way possible. So I'm going to yield the stage to Bobby Westbrook, who is actually the head of our emergency management efforts. And Bobby's going to walk you through what we did to support our transit agencies, and then talk briefly about the things that we're doing to handle emergency response efforts in a pandemic. So I'll get out of the squeaky chair and turn it over to Bobby.
Thank you, Liz. Good afternoon, everyone.
Bobby, you're muted. Unmute yourself.
Okay,
There you go.
My apologies for that. Good afternoon, everyone. I believe it was March 9th when we were activated on the emergency management side. I know one of the issues that we've dealt with since activation, I think the last time we remained activated for an extended length of time was in 2004. Florida experienced, I believe it was 5 hurricanes, 1 tropical storm in a matter of 6 weeks. The emergency management team stayed activated for quite a length of time. Anybody that works emergency management knows that you stay activated until you've closed all issues and restored the infrastructure. So the 6 weeks extended out into several months. Not since then have we remained activated so long. So I know that from our perspective, keeping the emergency management team engaged and working through this issue, rotating them in and out so they're able to get a little bit of a break. It's been quite of an adjustment for us. Initially, when the pandemic first hit, we struggled getting our feet under us and trying to figure out what direction to go. Naturally, this is much different than dealing with most of your disasters that occur. We, unfortunately, we had a good bit of practice in dealing with hurricanes and flooding, but this was outside of that wheelhouse. Getting the team going and doing what we needed to do, I'm sure that most of you would agree on this, that initially it was a little bit of a shell shock and understanding exactly how we could serve our agencies and get them what they're needing out there. We started off with daily phone calls with our emergency team, trying to, I'm sorry, Richard, go on to that first page. Thank you. We started off with daily conference calls with the EM team. In Florida, our emergency management team, we have members that are located North Florida, Central, and South. Pretty big state, so we have our team spread out like that. So we've always got somebody in close proximity to where the disaster occurs. The daily calls were mostly focused around understanding the situation and trying to figure what our next move was on meeting the transit agency's needs. It immediately became clear that a lot of the the transit agency success and local government bodies were trying to make their decisions on what to do with public transportation, how would it proceed, what would be their protocol on how they handle it, and it quickly became evident that getting them the information that they needed to make their decisions on what policies they put in place was vital. We created a listserv that became a lifeline for the transit agencies. Not only did they have the ability to communicate with us directly in state emergency operations, but they also had the ability to communicate amongst themselves. And the exchange of information was vital in a lot of them making their decisions on exactly how to proceed. It also became evident that, as everyone quickly found out, the supplies that were needed, particularly in cleaning of the buses, that became a huge issue. The mask, the PPE for everyone to use. It's one thing to have a policy, it's another thing to have the resources in to implement that policy. I was very fortunate. I have someone here in our office who is extremely good on resourcing items. We put them on spending the largest time, majority of their day searching for those items and then posting it out on our listserv. That became a constant for quite a while. Once we found supplies, they were quickly exhausted and we were constantly seeking additional sources. That was a tremendous help to the transit agencies once they were able to obtain those supplies. As most of you know, that eventually somewhat stabilized. We still run into occasional issue, but for the most part, we're able to secure what we needed. Several of the transit systems have proposed putting some type of barrier in the bus, protecting their drivers. Initially, what we were seeing with some of the designs that went in there raised some concerns. We had advised the transit agencies that they needed to perform risk assessments before making those modifications to the bus. We saw very little change in what was taking place out there. There are concerns when installing those barriers from a maintenance perspective or from a vehicle design perspective, your air circulation inside the bus and how that affects your heating and ventilation system. It's critical. My apologies. We also knew that there was a safety aspect to it. We do crash testing and analysis here in the state, and we knew that the design of the barrier could impact removal of trying to extract that driver should an accident occurred. So we wanted to make sure that those types of items were addressed as well. What we did on the state side was put guidance out that basically walked them through the items that they should look at when performing their risk assessment and what to take into consideration when laying out their designs for those barriers. We also looked for sources to manufacture those barriers. That was a little difficult at first. A lot of our larger urban systems had the resources to build their own. A lot of our small systems did not. Contracting with those companies, it was a little bit of a struggle at first, but once we had guidance and clear explanation on what it was we're looking for with the barriers and what the parameters were, and we were able to distribute that out to some of the sources that could build them for our smaller systems, we've seen that has started to resolve itself. Naturally, we were also trying to seek information. And I'm sure most of you would agree that that there seemed to be a flood of information coming out. And if you were trying to track every webinar, every source of information, it was a little overwhelming of everything that was coming out of there. We divided up our team and started assigning different team members to whatever webinar we came across that might be of interest, and started vetting through those and determining what was just the repeat of basically the same information and what was good information. And we would then in turn post that on our listservs and make sure that our transit agencies had access to that. Next page, please, sir. This is some pictures of some of the different mitigation measures that the agencies were taking. I know that at the same time that they were putting these measures in place, a lot of them were putting policies in place relating to some form of screening the drivers through temperature checks or whatever they had determined that was appropriate for their area, or the requirement to wear a mask. Liz and I were initially concerned and cautioning our agencies to make sure that they stay within the parameters of civil rights requirements, ADA requirements. That stabilized very quickly. I know that there was some, and I'm not going to get into the politics of it, I don't care to go there, but there's been resistance on whether you should wear a mask, you shouldn't wear a mask. And basically what we've seen based on the geographical area is how the public responds. Some municipalities were very receptive to it. They were wanting to do whatever they could to ensure protection of everyone. Others were resistant to it. How the drivers and these supervisors interacted with the public. We brought that up in several meetings. We encouraged the agencies to discuss that amongst themselves. And we're looking at addressing that in training programs that we're currently putting together for our agencies. Next slide, please, Richard. This is some of the examples of the social distancing marketing efforts, so to say, by our transit agencies. I do know that as the agencies were looking for the various forms of mitigation that they could put out there, we were actively pursuing the spread of virus within the transit bus itself. And we were looking at both transmission from airborne and contact, and then making our decisions on what forms of mitigation that should be, whether that's cleaning procedures, UV lighting. There's various other technologies and resources that are out there. Initially, there was very little information on how effective they were, and we struggled with that at first. New York Metro had commissioned a study to be done by a group called WSP. That group produced a report that, and I'm just wanting to pass this along, we found it extremely useful. It answered a lot of our questions on the air circulation, the different mitigation measures that you could take, and their effectiveness. We posted that report on our listserv. We've also taken that document and used it to develop a statewide contract for equipment that the agencies are needing to handle the pandemic. It was very useful on us on putting that RFP together, and we have just recently advertised that and hope to have that contract out on the street pretty soon. The with the pandemic, with the reducing ridership, it hasn't really been an issue. I know that most of you have looked at rear door loading fares or fare free versus fares. And we struggle with that in Florida as well. Exactly what was effective and what was not. And surprisingly, it was it varied from one area of Florida to the other on how successful it was or how it unsuccessfully was. But from a capacity standpoint, we also, hurricane season was approaching, and we were asking ourselves, what would we do in the event of a hurricane? How do we respond? Typically, during an event, I'll use the most recent hurricane that hit the Panama City area, made landfall as a Category 4. The transit system took a very hard hit. Immediately, the need for transportation, providing the life-sustaining trips was critical. The transit system was overwhelmed. Their workforce was cut by almost 2/3 initially. They were struggling to get up on their feet and meet the public's needs. And as typical during one of these types of events, we started coordinating getting equipment and drivers in from neighboring transit properties to come in and assist. And we've had to do that numerous times, and it's quite a task to get that pulled off. But with the pandemic, we also face the issues of capacity, where typically in the past we knew exactly what the capacity, what the needs were, and we knew exactly what type of equipment to send in. With our social distancing, we developed a policy of how we should respond and what would take place as far as the sanitization of the equipment once it transferred from this agency to this agency. And we developed a policy on how that occur. How effective that policy is, we haven't found out yet. I hope we don't. So next slide, please, Richard. This is some examples of marketing materials that our agencies have used. I've also seen some from other transit systems around the country, and some of it's some really good stuff. We take everything that we can find like this, and we're sharing this on our listserv to all of our agencies in the state of Florida, so they can see what their neighbors and their colleagues are doing around the state to help guide them in how they handle the situation. Next slide, please, Richard. Establishing our role, how we respond, the information that's going out. Naturally, we got a lot of our guidance from CDC, WHO, and OCEAN. We also found the bullets listed on our source of materials. These were very good sources, as most of you know. From these and from other experiences and various things that we discovered around the country, we developed a emergency management tips and practices for bus transit systems. It's basically a summary of everything we've been able to find to help those agencies and local governments make their decisions. If any of you are interested, that document is available. Just let Liz or I know, and we'll get it into your hands immediately. And for your transit agencies that are trying to make the decisions on their cleaning methodology, their barriers, et cetera, those types of things, I do urge those agencies to go look at that report that I referenced earlier, that was developed by New York Metro. Next page, please. What does emergency response look like during a pandemic? Like I said earlier, we have a plan. Whether or not it's effective or not, we don't know until we're put into that situation. I know how difficult it's going to be. We feel pretty confident with our plan, but again, as we've learned with the pandemic, yeah, you never know until you get into the middle of the situation. Most of what we put together in our plan has to do with the equipment needs and how to determine our capacities and therefore make the decision on what equipment to send in to a agency that's asking for outside help. We also, when we're sending resources in, whether it's part of our emergency team or whether it's drivers, supervisors, and technicians from other properties, we always establish housing and for them. Typically, DOT goes in and sets up a base camp. And we have the drivers, supervisors, et cetera, stay at that base camp. That provides them with all the necessities that they need while they're activated in that area. As everyone knows, you're without power, you're without other essentials, and it gives them all of those essentials. Working with our State Emergency Operations Office, we're trying to determine exactly how that's going to function under the pandemic. Naturally, of course, there'll be social distancing in place, all the other preventative measures that we're typically seeing put in place during the pandemic, but exactly how that's going to function and the impacts that it's going to have, it's similar to the buses. Our capacities are greatly affected, and the number of buses that we send in and the size of the buses suddenly becomes a very critical issue. The base camps are similar to that. We don't know exactly what their capacities are going to be. Our State Emergency Operations Center is working diligently to understand that and to make the best plans that they possibly can. In a brief overview, that's kind of what we're doing here in the state of Florida. There was a mention earlier about some form of debriefing afterwards to where nationally we could get together and talk, understanding how other people responded and actions that they've taken. We can all learn from each other, and hopefully out of that, we can develop some type of action plan for how to handle this in the future. As I said earlier, I believe we've got the role of emergency management pretty well down pat, with the exception of exactly how do you handle a pandemic. I encourage that to happen, and I look forward to it. If it does, I'll be glad to participate in that one. And that's the end of our presentation. I certainly appreciate your time. Richard, I'll turn it back over to you at this time.
I'm going to steal the mic. Richard, can you hear me all right?
I hear you perfectly.
Okay. Yeah. Good. We do have a couple of questions that came in. And so first of all, Bobby, you had a different citations in there, a WSP study. I saw that Cutter report, and I think you also mentioned a New York DOT report. The question is essentially, can you share? And so hopefully you can share, Richard can share with the.
Yes, absolutely. Right. We'll get those to Richard so he can disseminate them out to whoever's asking.
Great. And then the other question that came in is, what considerations has Florida made for evacuating individuals with functional and access needs during COVID-19? How do you deal with a double whammy of preparing for an evacuation in a socially distanced manner?
That's part of what I was referring to as in our standard operating procedures that we have for emergency management. We recently revised that to include an element in there about the adjustments that we would need to make during a pandemic. Rather than go into details on that, I will also be glad to share that document if anyone's requesting it.
Yeah, I think that's a great idea. What about, so I'm going to change this to more of the I don't know if political is the right word, aside. And so have you had any issues with unions? And also, how have your transit partners reacted? I know here in Washington, in some cases they say, oh, thanks for all this direction. In some cases they say, stay out of our business. And I'm curious about some of the response that that you might have had. So it seems like you're very well structured there. And so some people might thank you for it, and some people might say, get out of our way.
The good questions too. I'll take the union one first. Initially, we did. The union had reached out, expressed some concerns. We engaged them in conversation. I think that from our experience anyway, for the most part, they seem to grasp and understand that we're in the middle of a crisis here, and we need to work together as a team. And also, we work to try to make them understand during an emergency situation, our priority shifts to meeting the needs of the public, and that becomes top priority. So we work our way around issues, and I'm not saying violate any rule, but we work around rules or restraints that might be in place that impede us from doing so. The union seemed to be receptive to that, and since that occurred, for the most part, I'm knocking on wood here, so far, we seem to have a good partnership and understanding on where we're going. The transit systems reaction to all of this, I don't know. I think I'm extremely lucky to work at a DOT where we've developed such a good relationship with most of our transit partners. And what you're referring to, I understand. I've experienced that before. Stay out of our business and let us run it. But for the most part, I think with this situation, because everybody was struggling and trying to get a grip on what do we do, we've never faced a situation like this. Our experience was more along the lines of our agencies were saying, please, anything that you can help us or guidance you could give, we would greatly appreciate it.
Great.
So that's our experience.
Thank you. That's
Thank you.
awesome.
Thank you.
Let's move on to
Don, I think we lost you, or we're losing you.
Oh, I can hear you guys. Can you hear me?
Now I can.
Okay. Yeah. Hey, Charles, are you ready?
Yes, sir. We will
All
get
right, sir,
started
you're up.
as soon as the slides come up. Okay. Want to say good afternoon to everyone. And Liz and Bob, that was really good information. It gives us a lot of things that we can look at that we think can fit into some of the things that we're doing and going forward with. I was really pleased to hear that FTA says they're going to be putting together, if I understood it correctly, some way to kind of organize best practices as learning experiences, because that's something that we had been thinking that we would bring to the MTAP group for some of our research activities, because we've got to be able to get this information, not only just look back at it historically, but go forward to do planning with. So today I'm going to share with you essentially how the Mississippi DOT handled the response to the pandemic, but make some observations about how we're structured and what we normally do to try to get our transit providers as actively involved in serving the community as a whole as they possibly can. As a backdrop, and this is just purely to set the stage of what we were facing at the time of the pandemic, there were also issues of major budget crises going on here. There was a major initiative where a good portion of our population, and believe me, I say this just to set the backdrop, a good portion of our population was involved in a brouhaha about a new state flag, as well as Black Lives Matters. And you've had folks who are aligning in their particular camps, pushing back against regulations, pushing back against government, and touting the need to be able to be absolutely free to do what they chose to do. So along came the pandemic, and we were trying to institute response and recover and preparing for recovery with the idea that we're going to provide you information from the Department of Transportation, or part of the government. And a lot of folks at the local level were pushing back on that kind of guidance, but that gives you a mindset. I offer no political commentary, but just a mindset. Transit's role in pandemic response and preparing for the next crisis. Initially, when we were faced with this issue, the staff through our transit division, Shirley Wilson, Roger Bailey, and their staff spent a lot of time trying to communicate with our local transit providers. A good part of that initial effort was to let folks know that we would be with them in trying to make resources available. This is before the 100% money came available, looking at ways we could work through budgets and we could provide additional flexibility at the state level. One of the things that came up initially was the folks who are on the 5310 side of the house are really, and as they still are, really concerned about whether there's resources for them. And that's a problem that I think we have partially solved by utilizing what we call our regional groups. In the state of Mississippi, the rural transit, well, I guess all of our transit systems, because the urbans are part of it as well, we operate through a regional group concept where the state is divided into roughly 6 regions, and transit providers within those groups have formed their own regional planning and advisory groups that we help to fund and support. So a good part of what we were doing, we were working through those regional groups because they have the contacts at the local level. And the beauty of the regional group is there is no one transit provider who will be viewed as providing service on their own. The regional group concept is that 7, 8, 10, 12 transit providers that make up the group, you can have access to the resources that they have for scheduling trips, for backup, for joint purchasing. All those kind of things can help when these kind of situations you're faced with. So we started out with a series of conference calls and some Zoom meetings with our rural providers and our transportation commissioners to get some idea of what their priorities are and what are they doing that they could share with some of their peers. And we were having conference calls probably every 2 weeks, and then it ended up into monthly meetings or conference calls. And it turned out to be a really, really good practice. Let's get into the actual documents that we were producing. We took a pragmatic 2-phase approach because we felt that planning was essential to give folks some structure. And so we didn't have to duplicate a lot of effort. It gives, from our perspective, folks a sense of comfort that they have a process to follow and identify who to go to exactly. We developed initially a COVID-19 public transit initiative. Next slide, Richard. That initiative was designed to respond to the needs we were hearing from communities throughout the state, through our commissioners, as well as the Department of Human Services, as well as the aging community, that there were just tons of folks who needed to have access to local food delivery. There were food giveaways and food banks throughout every community, but folks didn't have access to get to them. And then non-emergency medical transportation services and limited shopping destinations. Next slide. So what this initiative initially was to provide access to the basic services and resources so that we could focus on those seniors and those persons with disabilities that have no options, in some cases, very limited options in most other cases. This is built around utilizing our public transit network of 5311s and 5310s, as well as having the core responsibilities at the regional group level. Next slide. What were the objectives of this initiative? Of course, it was to provide individuals with the ability to get delivery of prescriptions and meals. It was also to help equip our local transit employees with safety equipment. That was a major, major concern throughout our entire network. And then most importantly was to collaborate with other state agencies so we could identify who were the individuals in greatest need, but also to identify resources that could cover the cost of getting those services provided. We started hearing that there were dollars available through the local planning and development districts and area agencies on aging for transportation, for access, and our transit providers were also trying to cover those costs. So we saw that there was a potential to further duplication. That's why we pulled those folks in so we could have those discussions. Next. Before we get into the meat and potatoes of the guide that we're going to see in front of you here, I'll talk a little bit about how effective that initiative was. We did get a lot of responses from the aging community, the 5310s. We were able to work with them to identify resources that they were already receiving to specifically address the needs of the disabled communities and citizens, senior citizens. A lot of folks were so caught up in, a lot of providers were so caught up in the response to the immediate crisis that they did not stop to look at how they could share those resources and not bear all of the costs for my program or my population. We had initially approached our commission about setting up aside a pot of money, assuming that we were not going to be able to get too much of the money from the other partnering agencies. We had made a request for a small amount, about $500,000, and they were in a position to initially commit to that. But as with all DOT programs, we looked very, very, very hard to be able to replace that money with the money that's already out there. So to the extent that money was made available by DOT, that money essentially was used as match money when it was needed, and that was pre-COVID, pre 100% money. Overall, it was a good initiative. It was an immediate response to what we viewed as the largest single populations that did not have readily available public transportation for them. After we looked at that, we thought that there was a need to do some planning. I'm not talking about sitting down and collecting a bunch of data and doing a lot of analysis and somewhere down the line coming out with a document. It was actually a planning process that was going to get us a guide on how could we structure what we are going to do in the immediate term, in the midterm, and the long term. Next slide. Now, this pandemic guide is designed to provide a resource that would aid our transit providers, not only in protecting the health and welfare of their staff, but the consumers and the general public. Because there was so much concern, even from the beginning, about we don't have the ability to maintain our staff on board because they don't feel safe. A number of the riders that they had were backing away because they didn't feel safe. And the general public started to view the traditional transportation network, as we've seen grow into the entire marketplace now, I guess, is an unsafe mode of transportation. So we wanted to be able to address that. And we wanted to have a systematic approach to how we're going to meet these pandemic challenges. Next. The goal was to provide a framework. And in essence, what we wanted to produce was a guide that you could use rather than just a lot of high-level discussion. We wanted to have some tangible guidance on what steps to take. You'll see that we included plans of actions, we included timelines, and we gave some suggestions on policy as well. Next. The objectives would help define our approach to the new normal, and I know we've already probably tired of hearing that, but the new normal seems to be a new normal that is in a constant state of flux. We wanted to provide guidance for planning and response, not only during the pandemic, but after the pandemic as well. We wanted to identify considerations for what, when, how, and if services should be suspended, modified, or resumed, because those were real questions facing a lot of our folks. And we also, one of the most important things was to compile some existing resources and reference material. You put that all together so that you could share those resources, such as action plans and checklists. Next. What were our priorities as we were going into this? Well, we had discussions with our transit community. We talked to our partners in our coordinated planning process. And one of the things that became really, really obvious, beside the obvious that you need to get folks who need to have an immediate response because they're trying to get to treatment or testing for COVID, you got to be able to put services in place that's still going to get those needs of the, what we used to call the transit dependent population, satisfied first and foremost. There was all kind of discussion on how we're going to reinvent and how we're going to modify services, but we didn't want it to devolve into just an emergency response transportation service. We wanted to keep those services available for that broader community. The next priority was to make sure that our providers understood that their transit services needed to evolve to respond to the new challenges, and just to go back and start services where you discontinued them to the pre-COVID days was probably not going to work. One of the things that we found really significantly challenging was going to be to rebuild trust, because as the weeks went on, I think we all saw that trust in transit as a mode, a safe mode, became less and less and less. And then finally, we had to take some serious considerations on how we could update our financial management strategies with our transit providers so that we could get the best bang for the buck. But most importantly, some of you have heard me mention this before, we have to be able to justify, document, and explain how these dollars that we're getting in are being used. And we have to keep in, my approach is, we have to keep in mind that these dollars are not going to be guaranteed to be out there forever. We've got a lot of flexibility, but I'm really concerned that there will be effort to claw back some of those dollars. Next. Our focus areas of this guide, we included scenario planning, we included financial management, service and operational planning, and capital planning. And what the guide contains are some resources and some tools that can be used in each one of those areas. Next. If you take a look at what we tried to employ was the basic 5 steps of scenario planning that we could use within our office and within our subrecipients so that they could look at situations and do some real critical analysis, but not have to spend an inordinate amount of time and effort. And it's simply defining what the key questions and what the needs are, looking at what's really driving those, what are the factors that are contributing to them. Build some scenarios around the what ifs, develop some plans from those scenarios, implement those plans, and then monitor your results. And we think that that's a very good way to keep the cycle going of seeing planning as an iterative process. Next. The document itself contains a number of tools and templates that can be used. Some of the tools we were able to take from some existing reference material. Some of you may be familiar with the, I think it was an NCHRP study, 769, a guide for public transportation, pandemic planning and response, that was already in existence. It was in the process of being updated while this was being done. So we relied heavily on that. And we also relied heavily on some other information that was put out by some of the major consultant firms. So what you'll find in this document are action plans to manage cost and funding, to adapt to the evolving market, action plans for capital improvement, and then a summary action plan that the agency can use to position, based on their priorities, what they're going to do with their resources. The toolkit the guide contains some tools and checklists, pandemic activation matrix, vulnerability assessment, a really exhaustive decision-making and partnership checklist, disease prevention spread checklist, workforce, and one of the things that was really interesting was looking at public relations and media. It's not a how-to guide, but it does pose some significant questions out there. Next, please. That was the wrap-up, the high-level discussion of what we were doing. I provided Richard with a copy of the guide. We see that there are a lot of tweaks that we can make to what we've already produced. And again, I will acknowledge that I'm very impressed by what folks in Florida have put together. I think that that's something that we can use that will make a significant difference going forward for us as well. So we can answer questions as they come up, but I appreciate you listening.
So I'll say once again, people feel free to add things to the Q&A or the chat. Richard and I will keep an eye on that and share them. Charles, I'll ask the same question of you that I asked of Bobby. And how did your partners respond? Were they generally responsive and excited about the guidance and help that you provided? Or was there some stay out of my way? Were there any issues with unions? How responsive were people?
Yeah, very, very responsive overall. We really don't have union issues. There's only a couple of unionized transit providers in the entire state, and those are the urban systems. So we've had really good relationships in that regard. But our transit providers, particularly the rural providers in small urban, were key to what we were doing. They got into the mix and asked the questions. It was wonderful to have those conference calls that we were having because it just didn't discuss what does DOT says we should do next. And we're waiting on the guidance from DOT. They actually led some of the discussions on, here's what we're doing. We've done this over here. Have you thought about that? They were some of the best ways to identify to way to get additional PPE, to work with MEMA, because a number of our folks don't wait for you to tell them, here's the next step. They implement this kind of stuff as well. As a matter of fact, we were lucky enough through our transit provider community to identify some distilleries that were able to convert their usual product, vodka being one of them, for the manufacture of hand sanitizers, and identify that as a source of purchasing hand sanitizers in the bulk, like 5-gallon drums, and they shipped throughout the whole state. So that's one of the real benefits of working with them like that.
That's great. You know, it was kind of funny for us. We had our responses spanned the spectrum of possible responses with, normally I know who's going to fight me and who's not going to fight me. And it kind of flipped on its head this time. And so some of our largest systems said, thank you, state. And by the way, you should also require us all to do this, this, and this. Whereas some of the smaller systems who are normally really excited about help are like, stay back, my community doesn't even believe this is a thing. And so we work through that all, and we have good partnerships, and we're happy to do it. But I was just kind of surprised at the spectrum of responses that we got. So thank you, Charles, very much. I don't see any other questions at this time. Feel free to type something else in as we get into our facilitated discussion. I know most of you out there, and but there are some that I don't know. So what I would ask you to do is to go either into the participants list or the chat. And if you hover over your name, you can own name. You can then, what will it do? It'll say, you'll give you a choice to unmute or more. If you click on more, you can rename yourself and add your organization name after your name. And so that way we can all keep track of who's talking and what organizations they are with as we have this next part of the conversation. So thank you for considering doing that. Richard, I think it is time for us to get into our facilitated discussion, and we're going to use a series of questions. Thank you to Kelly Sean, who helped us put some of these together. I actually did a session very similar to this earlier in the week at our state conference, and we used borrowed some of the questions from there as well. And so some of the questions will be simply polls that you can click on, and some of them will be discussion topics for which there'll be a slide. Richard, you want to start us out?
So this is going to be our first poll ever using the Zoom technology. So fingers crossed. I'm going to launch the first poll. And the benefit of this versus the GoToWebinar is that even panelists will be allowed to vote. So there.
All right.
So thank you, Zoom. Here we go. How is your state handling the response to the COVID-19 pandemic for sub-recipients? Please, it's a multiple choice, multiple response, so feel free to answer.
And I think it's interesting that it's asking about your state and not your state DOT. So there might be a subtle difference there in the way that you answer that question.
All right, 50% responded. Come on, keep coming, people. We've got a lot of people on this call. I'm sorry, webinar. Hopefully we can get more than 50%. Oh, come on, we can do better than 52%.
And just so I got a couple of people now have contacted me, and the ability that we normally have in Zoom to do what I said about renaming yourself may not be on this Zoom webinar. And so I apologize for that if you're unable to go in and
Yeah, sorry everyone. This is my second Zoom webinar. I may not have turned off that restriction in the back end, so my apologies. All right, 62%. We're doing well.
All right, everyone get off your phones and answer.
Oh, that includes me, I guess. Oh, well.
Not me. I've never done that. Oh, wait,
right.
You said this is being recorded, so maybe I have.
All right, I think we're gonna, at the 3-minute mark, we're gonna call this. Coming up on 3 minutes. And I'm ending the poll right now. And now I'm going to share the results.
And so, Richard, do people have the ability in this format to raise their hands if they have any further comments or anything like that? Or maybe just chat into the chat box if they have any additional comments.
They can chat to the chat box. I'm pretty sure they can raise their hand. I hope they can raise their hand. Again, we'll see. Raise your hand using in the participant function. No, absolutely, you can raise your hand. We had it yesterday. Someone had raised their hand.
Oh, that's right.
Mackenzie from Illinois. So you feel free to raise your hand if you're interested in talking about your response. Otherwise, is there anything that's surprising here? We had a majority in state number 2.
I think it makes total sense in both. I know on my experience and what we heard from both Bobby and Charles, you know, we're basically doing this in partnership, and we're collecting best practices, sharing the best way to do it. I know I've looked on many of your websites across the states to try to find different things to copy and to do. And so I think it makes total sense that in our industry that we're doing this in a more collaborative manner.
All right, I'll stop sharing results. Should we launch the second poll, Don?
Yeah, I'm sorry, go for it, Richard.
Hey, Richard and Don, this is
Yes, Shane.
just as a reminder, these polls will be recorded and for folks to view later, so in case some people are writing down notes or whatever. So just wanted that as a reminder. Thanks.
And I can post a report with the results online as well. So stay tuned for that. Here we go, poll number 2. Regarding emergency/crisis planning, including COVID-19 response, please select among the following state agencies that your state DOT Transit Division, Bureau, or Office is coordinating with. It's multiple choice, multiple responses. Feel free to select as many as you'd like. Right, still 50% have voted. Come on, y'all.
Liz, Bobby, and Charles, I'll warn you that maybe on some of these I might call on you to share some of your reactions as well.
Yes, sir.
About 61%. Okay, we're over 2 minutes. We need to keep this ball rolling.
Yeah.
I'm going to end the poll and share the results.
Right. No, not many surprises. And it was interesting when I saw state attorney on the list, you know, I hadn't even really thought about it to going to them. I think Office of the Governor makes a lot of sense. In many cases, the governor has been the voice of this pandemic. You turn on the TV every night, it's what the different governors in the different states are leading. So it makes total sense that we'd be working with these folks. Our other panelists, do you have any comments? Does anything jump out to you on this list and the results?
I think the results are kind of consistent. The emergency management piece, we would always think that there's quite a bit of coordination, but Health and Human Service folks were really, really willing to come in and be partners this time with not quite as much of the usual, maybe suspect about what motives were.
Mm-hmm.
And I would agree, we work with the first four all the time. So it wasn't a stretch at all to work with those on this issue.
Could I ask a question about the civil rights piece for those people that were asking about the civil rights piece? Was it some environmental justice concerns or some equity concerns or what?
I know in Washington, what happened with many of our providers is when they decided to shrink routes or service, they made me nervous about the way that they made their decisions. And so, we had to have lots of conversations with our partners about, oh, did you consider, did you do any Title VI analysis about where you're cutting service and making those decisions? Even if some of the rules were suspended, and
Don, I think we lost
like
you.
I said,
There you go.
Sorry, I was going to say I'm doing my best, but I'm not really doing anything. It's whatever my connection is. Richard, why don't we go on to the next question?
Okay, let's exit out of here. But this was the question you wanted to address right after this.
Right, and so I encourage anybody to raise their hands if they want to help us answer this question. And panelists, please consider what you would say to this question as well. What kind of coordination and conversations are occurring at the state level? And it's implicit in many of the different questions and slides that we've seen already, and we heard it in both of the presentations. There are several different agencies with a hand in this. And so we had in Washington State, it was the governor's office. It was, we're working with the transit agencies. I'm setting up meetings with nonprofits, labor and industries, and the Department of Health. And one of the other things that we're noticing is this coordination is happening both at the local level with the local departments of health and at the statewide level. And so we've actually gotten to the point where we've developed Q&As, and so that one of the downsides of it happening on all those different fronts is people are given different answers. So Charles and Liz, what's your reaction to this question?
Well, I think as we stated earlier that we are trying to use the regional coordination groups out there as the folks who can get the heartbeat of what local folks really want and how that's going to work. We're trying to get mayors and supervisors and those folks involved in the process. So getting that kind of discussion going was not as surprising. It was a part of what we would normally be doing anyway. And we've really got some transit providers who've taken the lead on these regional group processes that have really, really just hit a home run. They've gotten folks to really come and talk about where are we going in the future. That's what we are looking at right now, because we think we've pretty much responded quite well in the response section, in the response phase. But recovering going forward, we're still a little bit leery about where we're heading, because dollars for local match when the FTA 100% money runs out is probably the biggest 800-pound gorilla that's still in the room.
And I would agree with Charles on that. A lot of the agencies up front saw the CARES Act money as a windfall. And we did a lot of work with our subrecipients in making sure they understood that they needed to plan for the future, because right from the beginning, we saw the dips in local tax revenues and things like that. So we wanted them to make sure that they did what they needed to do to keep people on the payroll, and then also plan for the future. I think another good thing that came out of it for us was we have always had a very strong relationship with the Florida Public Transportation Association, but through dealing with different pandemic issues, in the beginning, we participated, actually acted as the speakers in webinars that the FPTA was hosting for its members. And conversely, now as we move forward with dealing with the emergency response and other things in the pandemic, the FPTA is actually hosting several webinars and providing more information that we are also using for our rural subrecipients. So all in all, we've really expanded on some of the relationships that we've already had, and have a great conversation moving forward on what it's going to look like post-pandemic.
Awesome. So not seeing anything in the chat. Richard, any? Oh, I do see there's a hand up. Caitlin.
Yeah, I will allow Caitlin to talk. Caitlin, your line should be open.
Hello. So TDOT has been, like Florida, we've been really involved with the Tennessee Public Transit Association, and we've actually been meeting via Zoom with them every week. We've had them submit to us. We have like a Google spreadsheet going where we can track their weekly ridership numbers to gauge across the different types of providers, how much their ridership is going down or how much is recovering. And then we can also produce those numbers for a statewide picture. And then every month they provide us with their farebox revenue compared to the same time in 2019. So we see sort of the statewide picture of where things are at. And on those weekly calls, Region 4, FTA Region 4 participates. And so does the lobbyist that they employ in DC, and they provide weekly updates on what's happening in Congress in terms of, relief and FAST Act reauthorization. And then TDOT is part of that as well. And we provide regular updates to them, and then they provide feedback to us about what they're seeing on the ground and what kinds of questions they have. So that's been super helpful. And we've really opened up the line of communication all the way through to FTA. Dr. Taylor's been on those calls almost every week. And it's been really helpful.
All right, Richard, let's go on to the next question.
Right, hold on. Let's open. Launching the next poll. Regarding emergencies. Oh, sorry, go ahead, Don, please.
I think you've got the radio voice. Go for it.
Regarding emergency crisis planning, including COVID-19 response, please select among the following federal departments, agencies that your state DOT is coordinating with. It's a multiple choice question, so please select among many of them if they're relevant to you.
I think that's great. And rather than just have dead air while we do this, I think the panelists should discuss while we wait for the poll results. And let's
That's
see.
what they're there for.
Yeah, absolutely.
Captive audience, I like that.
Yeah. And there's only a few, so it's very easy for me to call on them. And I'll start, with for obviously FTA, working very closely with them. We had some great presentations from FEMA also, especially a lot of our partners were curious about how to apply for extra money. And so we were able to put some FEMA listening discussions together. But that was it in terms of the folks that we work from on the federal level. It was interesting to me also that a lot of this discussion with FTA was in our SSO responsibilities and debating about what our oversight role was when it came to COVID. And in the end, we decided that it fit within that area, so that we did include some of that. Charles or Liz?
Okay, I'm on now. I was talking and it was muted. I'm sorry. The one federal agency that's not listed here that we've had some involvement with and communicating with here in Mississippi has been Federal Highway as well.
Ooh.
Our Department of Transportation is, all things lead to the altar of Federal Highway, even the Federal Transit Program. So when we've been looking at how we can share in resource planning, and we've actually tried to find some way if there were additional federal highway dollars that we were not aware of on the transit side that could be used to support transit activities. But the other two would be what we'd have expected. MEMA has been our emergency management, Mississippi Emergency Management Agency was our way to get to FEMA.
And our office, our public transportation office, is only coordinated with FTA. Now, I do know there are other efforts going on throughout the department, but I honestly can't speak to those.
All right, I'm going to end the poll. It's at 3 minutes, and now I'm going to share the results.
No surprises. It's interesting that, so we talked a little bit about FEMA. I'd be really interested to hear from anyone who clicked on 2 and 3 with either Centers for Disease Control and Prevention, I guess that's CDC, or Department of Health and Human Services about what your experience was and why you did that outreach.
Yes, please feel free to raise your hand. And also, I find surprising that none of the above, I'd just be curious if the none of the above was Charles's FHWA or another DOT administration. I'd be curious who that respondent was and what we missed. So please feel free to raise your hand in the participant function, and I will open your line, similar to what I did for Caitlin from Tennessee. Any takers? Just surprised we're a very shy group.
Mm-hmm. Well, all right. In the interest of moving us along, so feel free, if you were too shy to click on it or had other technical issues, type your answer in the chat about you worked with CDC. Or
I think
FEMA,
the chat function is actually disabled for people, for participants. So if you want, again, send it in the question and answer section. Send us a question with your
response.
Otherwise, I'm going to stop these results, and I'm going to open up. Actually, well, let me open up the next poll. All right. What measures are your transit systems using to ensure rider safety, even if the state does not have a mandate/requirement?
So that's a pretty easy one, I think. I know for us, it was essentially all of the above. The real interesting thing that I've seen is in Oregon, and I don't know if we have anybody from Oregon on the line, but they did for socially distancing, they said when you're on a bus, it only has to be 3 feet and not 6 feet. So I'd love, if there anyone from Oregon is on the line, feel free to raise your hand and comment on how that came about and how successful you feel it's been. We had many of our transit agencies here in Washington look to that one and say, oh, our lives would be so much easier if we could do that. But the response that the governor's office and the Department of Health gave from our standpoint was, we don't think that would really work. And I know a lot of our providers were a little bit disappointed about that element. Liz or Charles, any thoughts on this question and the response?
Well, I'm going to step in here because I thought it was interesting. Almost everybody went to a mask wearing mandate. Now, when we gave agencies suggestions, we said it was a local decision. And surprisingly, almost everybody went to mask mandates. But interestingly enough, there were issues at some properties when folks didn't wear a mask and what the drivers were allowed to do. And I actually thought that was pretty interesting. One property went as far as to allow drivers to call dispatch and ask law enforcement to come out if passengers refused to wear a mask. So that's what I found interesting with that particular one.
All right, we're at 2.5 minutes. I think the number of people responding have diminished to nothing. And now we will just end this poll and share the results.
Charles, any thoughts?
Unmute again, I'm sorry. I think that what we've got is a profile pretty much of what we expected. They're just, as the guidance came out, there seems to have been more emphasis placed on various protective measures as opposed to non-protective measures. There is going to be an interesting development, I think, as we see with the potential for vaccines to be distributed, whether we'll see more folks who will just shed precautions. I'm not necessarily talking about wearing masks, but shed all precautions, pretty much saying that, you know, all bets are off. I think that we have to do some really, really careful soul searching and do some precautionary planning to not let that happen too prematurely, because we could find ourselves right back where we started from.
I think that's right. You know, we've seen it already here in Washington. I'm assuming it's happening all over the country where the rates go up and down constantly, and people are pretty quick to get relaxed when it appears that the rates are going down. You know, getting back to Liz's conversation about the masks, one of the things that we have happen here in Washington is we didn't mandate wearing of masks, specifically for transit, I should say. We did it for all businesses, but we actually had some of the transits come to the governor and say, please put this requirement in place. So, that was interesting. In addition, though, what's happened for many of the folks that I've heard with and talked with is they've told their drivers, this is like fare enforcement. You tell them that they have to wear a mask, but if they argue or start to push their way on the bus, you don't do anything about it. We've had conversations with law enforcement, and they said, don't call us for mask enforcement. It won't rise as a priority. And so because of that, many of our systems have, like I said, basically say it's a requirement, but don't force people off the bus or anything like that if people fight them on it.
A little bit.
All right.
So let me stop sharing these results. And I think we can go on to the interesting discussion question with the panelists.
While you
participants.
Could we throw something out quickly?
Absolutely.
We're talking about COVID and everything we're focusing on. The conventional wisdom now is that there's a real potential for us to have another major outbreak of flu that could compound where we are now. Yep. And I'm wondering how we should be prepared as we've implemented all of these safety measures, precautionary measures, to consider some of this going on in the long term, just not driven by COVID, but to reduce infectious disease control, well, to improve infectious disease control across the board.
And do you have any thoughts on that? And do you have an answer for your question?
Well, I would think that some of us, we're going to have as much effort as we possibly can put into reviving the sense of transit is a safe alternative. And we run the risk, if we have just overcome the COVID situation reasonably well, but you start having significant outbreaks and people start coming back, then you're going to have folks who are going to turn away from transit even again. So I would like for us to consider, while we don't necessarily implement all of these requirements, that we consider making that part of business as usual. Particularly the air filtration systems, the UVA lights, all those kind of things.
Well, it'll be interesting too. So once we have all this infrastructure put in, from barriers to filtration, even all the masks, cloth masks that everyone are going out and buying, we're going to have that stuff available to us. It's hard to imagine that we'll go straight to dismantling it. The question is, does it become part of standard practice? I think we've all seen that, you know, in many cultures all over the world, wearing masks is pretty standard. You're not surprised when you see someone wearing a mask. And we're all learning that it may mean that they're protecting me rather than being afraid of whatever thing I might be given to them. So it'll be fascinating to see this as we move through. You know, basically where we are talking now about this question about what becomes permanent. I invite anybody who would like to comment to raise their hand, put something into the Q&A box. And Liz, what are your thoughts?
Well, Bobby just agreed wholeheartedly with Charles, and we believe that moving forward, things like filtration systems, the UV lighting, the sanitation procedures, all of that is going to become part of the total transit operation. I do think it's interesting, our systems here in Florida are working with some folks in my office to actually develop some kind of joint messaging that goes out about the safety of transit. Again, it's being designed by the transit systems themselves with some assistance from our staff. So it will be a message that comes from them, but we just thought it was something we could do to assist and bring them all together to develop that message.
Great, thank you. I think we're in agreement. It's awesome. So let's, we're gonna have one more poll question. These are not all the poll questions that we came up with. So after this, Richard is going to share through an alert the remaining poll questions, or I don't know, do them as a whole, we'll see, and have people respond to them, and then we can track the results. And if it garners any discussion, we can discuss it at a future MTAP meeting.
So this is the last poll question we have with multiple choice answers. The other questions we have are more around the line of discussion questions among members, but we'd love to see their responses, because like Don said, I think it would make for a great discussion over the course of the next MTAP call, not the next MTAP call, probably the October, November MTAP calls, and or we could do a presentation of sorts on this based on the responses, but it requires a little bit more in-depth discussion, which would require more writing. So we'll send those out via an alert, and members could respond, you know, at their convenience rather than directly on here. But this is the last poll that we're going to launch right now. In terms of your future emergency crisis plan, please select among the following changes you anticipate to future vehicle procurement specs. Please select more than one. It is a multiple choice, multiple response.
So I think this follows up on the conversation we've just been having. You know, it was easy for me. I just went, yes, 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 yes. You know, I think this is going to be much part of the way that we do business. Liz or Charles, anything to share or add on that?
I think we have to look at the realities, and that's why we were talking about financial management procedures and planning. Even though we all agree in theory that we want to maintain all the gains that we've made and the changes in how we physically provide the services, we need not overlook the fact that we're also talking about increasing cost. And for transit systems, particularly small rural systems, the increase in cost are going to be significant for them to bear at a time. And I really believe that we've got a probably 2 to 3 year period that we're going to look at where local match funds are going to become very, very difficult to come by. I'll throw in a shameless plug when we mention that. You know, through our MTAP network research program, we're getting a product that helps to identify local match resources and how we can use in-kind and those other things. So I think it's time for us to take something like that and take a look at and see what value has been added from that research activity, and maybe go one step beyond, because I really am convinced that shortage of match money is going to be almost impossible for some of our subrecipients to overcome.
I think there's also going to be, well, directly related, I should say, is it's a preservation problem. And everyone is going to be rating their capital reserve funds in order to keep wheels turning on the street in their operations. We've seen this in the past 2 recessions. And so it'll likely be to continue. And so money for bus replacement is going to be a huge issue as we come out of the associated recession that goes along with the pandemic. Liz, any responses?
And here are the results too.
Our response is ditto. All of that is going to be true. Match money, both urban and rural, is going to be a huge issue. And a focus solely on capital is not going to keep people moving. But it gets to that issue, and we're dealing with it in Florida, on what transit should look like moving forward. Maybe the existing services need to be restructured so they better meet the new reality of the world moving forward.
Great. Thank you. Thank you to our panelists. I really appreciate it. Thank you to the people who were on earlier as well. I think it's very helpful, as I said at the beginning, to know what our partners across the country are doing and how they're approaching things differently. I think we're interested in the different documents that were cited and shared already. So it'll be a great source for us to use as we do our own local planning here. Richard, I will hand it off to you to close us out.
I just want to thank everyone for participating in today's end of summer virtual meeting. This is week 1, session 2. If you have any questions, feel free to contact me or contact Shane. Our contact information is below. But if you don't already know it, then I'm going to say I'm sorry. You should. I'm surprised people don't have this stuff memorized or have us in your speed dial, because you should, because we're your resource for everything that happens through AASHTO and through the Council on Public Transportation and through MTAP. And we love serving in that capacity. Thank you. Have a great rest of your day. Shane, I don't know if you have anything you want to close with.
No, that's just, we look forward to seeing you guys next week in our sessions.
Next week, next Tuesday at 1:30 p.m. Eastern. It'll be about mobility management, past, present, and future. Have a great day, everyone. You should be getting an email, hopefully, from me in the next hour with all the information that was distributed on today's webinar. Have a great rest of your day.